and welcome to CIO News. I am Afreen Khan, your host for the broadcast and head of operations at CIO News. This is our exclusive fireside chat powered by GoTo, specifically for the healthcare industry. This is a recorded session and will be available on our website, cionews.co.in, and our CIO News LinkedIn handle. I am very excited to invite my guest today, Mr. Arun Goyal, who is the CIO at Sir Ganga Hospital. Mr. Goyal possesses 30 plus years of experience in government and corporate at the CXO level, spanning across different verticals and industries like ITES, healthcare, and digital health. He is deft in interfacing with top management, driving direct teams, collaborating with cross functional resources, and handling external stakeholders, including vendors and statutory bodies, for evolving strategic vision and driving change. Mr. Goyal, we welcome you to the CIO News. I also have
Thank you.
along with me, I also have along with me Miss Triveni Rabindraraj. She is the India sales head at GoTo. Triveni possesses 21 plus years of experience across business development, strategic alliances, and people management. She has worked with brands such as Wipro, Dun& Bradstreet, Citi, and many more. So, welcome, Triveni.
Thank you.
All right. So, just to begin with, Mr. Goyal, my first question to you would be: we all know that it has COVID changed our lives. So, what does your typical role look like working in the post-COVID era?
Yeah, thank you, Afreen, for inviting me on this. Yeah, COVID has obviously accelerated the digital transformation into the healthcare specifically. And earlier, there was a perception and misconception across the industry that healthcare is lagging into the digitization of the healthcare. So COVID made clinicians as well as patient both to push towards the digitization, and now everybody in the healthcare arena is accepting and adopting the digitization very rapidly, and they are asking for it themselves. Earlier, we were forcing all the digitization from our side, but now the acceptability across the healthcare has increased in all the dimensions and all fold. So that is the one thing which which is a good for the digitization acceptance. So we need not to push respective stakeholders. So now whatever initiative being taken up by the CIOs or CDOs or CXOs is being widely accepted very well, be it be it the EMR, be it the implementation of the ABDM, be it digital reports, be it digital appointments, be it teleconsultation, everything across the healthcare, digital transformation is increased. Credit goes to the COVID.
All right. Triveni, the same question for you. We all know that, internally in organizations, there has been a transformation in the way people have started working. So, what does your typical role look like? How has it been for you post-COVID era?
Yeah, I think, like Mr. Goyal mentioned, right, it's made life easier for a lot of us in IT, right? Earlier, the acceptance was not, I mean, it was there, but looking at the investment, and obviously because the ROI is not directly visible, right? And hence, there was always a hesitation from the management for investing in digital tools and, in fact, digital transformation itself, right? But like Mr. Goyal rightly mentioned, I think COVID really sort of bridged that gap, and especially in healthcare, right? Because healthcare was one industry which was, you know, supposed to be on its toes at that point in time, given, in spite of having so many difficulties, not being able to meet patient face to face. The basic thing, what was there, I think that itself was a big challenge. So obviously, the industry saw the benefit of going digital, right? And I think also another thing that we saw in this industry is the acceptance for cloud, right? Obviously, in the pre-COVID era, cloud was always looked at as something a platform which is not secure, platform, and obviously even governments and public sector were not very open to cloud, especially public cloud. But I think COVID forced that part as well, right? Because obviously cloud, transitioning to cloud meant that they it was business as usual for them. So I think in a lot of ways it's definitely helped the IT industry, specifically in certain regulated industries, and I think that's going to continue. Given the fact that we've all seen the ease of use of digital and cloud, I think that's definitely going to continue, right? Even simple things like telemedicine. Even now, right? And that's like a blessing for senior citizens even now, right? Like I hardly take my parents to the hospitals these days, right? Because it's not convenient for them to also be mobile. So I think definitely COVID has been a game changer.
Great, great. So we all know that the way people have started working in the post-COVID era, it has been very flexible, and and the workforce has been distributed. So, Mr. Goyal, given the demand of today's distributed workforce, we all know that it has become imperative to scale up and arm the IT teams with the right tools. So, in your industry, what have been the demands of your IT ecosystem on this front?
Uh, so far as the resources are concerned, there have been challenges into the IT industry all across. But specifically, if you speak about the healthcare arena, yes, resources have been challenged, and particularly in the hospital industry, resources are challenged because the paying scales, I would say, is not at par with the IT industry for the IT resources in the hospitals. So, in the hospital, the IT resources are the second priority. The first priorities are others, the clinical resources. So, hospitals are not that much good paymaster as much as IT industry and the IT resources gets outside the hospitals. So, obviously, resources in the hospital industry have been challenges all through the beginning of the hospital industry. So yes, that challenges are there. We are meeting it by outsourcing these type of services, or maybe retaining these resources by somehow giving an increment, promotions, etc.
All right. And considering the kind of industry healthcare is, we know that data in your kind of an industry, and specifically with regard to, because it's personal and health information of individuals. So I'm sure there's an increased pressure on the healthcare industry to ensure that this is protected, and also the access to this data is only restricted to authorized personnel. So, how confident are you in terms of your remote support software, if there is any, and also if it keeps your data secure, and if these technologies are, compliant with HIPAA, GSPR, PII, or PHI?
Yeah. So, so far as the data security is concerned in the healthcare industry, um, in the absence of specifically any healthcare regulation in India, which covers a regulation about the data privacy and data security, like HIPAA, etc., uh, we are still following all the guidelines as at par with the HIPAA or the GDPR, to make sure that our data or patient data is properly secured and the access to the data is as per the guidelines. And be it the patient or to the internal hospital stakeholders, all have role-based access to the patient data or otherwise other healthcare data. Furthermore, so far as the security is concerned, we have taken all the security measures to make sure that in external attacks are prevented and internal inside out attacks are prevented. So from that perspective, we have taken all the measures, all possible measures, I would say, because security is not 100% ever. So whatever possible security measures could be taken, we have already taken. And for the BCP point of view, the backup policy, etc., are in place, wherein we have differential backup of the hourly differential backup, or daily backup, weekly backup, monthly backups, etc., in three phases, in three different mediums, online, offline, on cloud, so that in case of any eventuality, we are safe and we can recover the data. Furthermore, to make sure that these type of steps and measures are in place in the event of exigencies, we have put in the SOPs, wherein all the such type of backups are being restored quarterly, so that all the backups which are there should be restored online in the production and doesn't fails in the event of exigencies. So those type of measures have already been taken, uh, but security is never 100%. Uh, so that way we have secured inside, outside attack and accesses of the patient data.
Great. I think that has been, a kind of an established ecosystem that you already have with regard to security. Um, a similar question to you, Triveni, on that note, that we also know that data in organizations, and particularly security, the entire cybersecurity piece, is one of the top priorities across organizations. So, what
Yeah.
do you think are the standards by which an IT tool should adhere?
Yeah, yeah, absolutely right. Like Mr. Goyal mentioned today, I think security is just not a KPI of the info security organization, or it's just not the responsibility of CISOs. It is definitely a business responsibility because on one side we obviously saw the advantages of COVID, but on the other side we also saw the vulnerabilities that it opened up to, right? And we saw a lot of big companies, even a small sized companies, being victim to the cyber attacks, right? I mean, obviously the one that we have heard recently is in the medical industry, the AIMS one, right? I mean, who would have thought such an attack would happen? But like, we none of us are spared, be it as consumers or be it as employees or employers. And specifically in the healthcare industry, because the kind of data that we deal with is extremely confidential, right? Like the patient level data. IT security is, I think, of prime importance, right? In fact, if you ask me, we've been interviewing CIOs like Mr. Goyal, and that's the first thing they say keeps them awake in the night, right? That's the first thing. Um, and one of the things is, obviously, digitization has led to it, but there are a lot of measures that we can look at it. Two things very important, right? One is the obvious thing that we all look at is the device security and the ecosystem security. But the second point, which is normally overseen, is people. And if you see the recent attacks, right? In fact, I think there is this organization called DPIR, right? These guys do research in the breach, how a breach is conducted, etc. So it was told that 80% of the breaches that happened post COVID were all because of human element. When I say human element, it could, and out of that 80%, almost 72% was all phishing. It's not any high funder technology. So cyber security criminals or malicious actors are getting cleverer by the day, and they are attacking individuals than really the entire system, right? So I think security education has become very, very critical today. Very, like they say, right? The weakest link in your security chain are the people, right? So it's imperative for getting all employees like us trained, and it should just, earlier it used to just be a tick in the box, right? That ठीक है, security awareness करवाना है तो we would do it twice in a year, kind of a thing. But today, obviously, it needs to be taken much more seriously, and I think phishing drills need to be conducted very, very often, right? As often as twice in a quarter, or depending on the sensitivity of the data. I think that's one, and the other one is obviously, to choose uh, security, or to choose IT tools which are looks at compliance. Specifically with remote tools, because now the usage of remote tools have gone up almost by 180%, ever since COVID, right? And remote tools are one of the, what do I say? They are like the door openers for the malicious actors to actually get into your system. So how do we sort of ensure that that is protected? So we need to have some secure connection methods. Look at zero trust IT security, security architecture, because the zero test trust security does not really sort of believe anybody, or at any point, every point you need to authenticate yourself over and over again. So that is definitely one aspect of it. And the other one, like I said, compliance. Going back to that, I think ensuring that the tools should not have access to the PHI level data, which is so critical in the healthcare industry, and also the tools being compliant to GDPR and HIPAA. These really become a very big, what do I say, focus for, or one of the things that we need to evaluate when we are looking at any kind of an IT tool.
So, Triveni, I'll take a cue from your inputs, and I 2 points particularly from there. One is the human element that we just spoke about, and the second is the remote working piece. So, Mr. Goyal, my next question to you would be based that we know that most of the time an organization's productivity usually suffers if people are working remotely, and then there's a lack of technical assistance. So, how have you been managing that? And how do you think has technology been a helping hand in managing such remote work scenarios?
So, Afrin, see that way in the hospital industry, that was not the I would say the challenge, because most of the staff required to be in the hospital premises. So, remote working is not encouraged and was not there as much in the non-hospital industry. So we don't have, even we don't provide or discourage people having the laptops in the organizations. So mostly we have the desktop sitting across the nursing stations or be into the backend offices. So very few people, those who are working into IT, etc., have a laptop, but and they are also working in the office itself to support the respective departments. So remote, yeah. So remote work is not available. That particular luxury is not available with the hospital industry.
I think when I go back and think about it, yes, absolutely, because it's about the presence that matters in the hospitals, and less about who is outside the hospital and connected. So
Yeah.
totally get your point, Mr. Goyal there. So Triveni, on that note, uh, for an organization like yours, what do you think should be the top priorities when considering remote support solutions on that?
Yeah, yeah, absolutely. So, like Mr. Goyal said that I think barring healthcare industry, most of them have gone remote, right? One that is definitely there. The only thing is, when looking at remote tools for the hospital industry, it would be more maybe looking at the endpoint management and things like that, right? Because that may not be remote meeting tools, may not, or remote support tools may not be of, or remote support tools also for hospitals which have multiple facility, etc., right? Because you may not have, like he said, right, the resources are a big constraint in the especially in the IT field. So you may not have the luxury of having IT team in every hospital premise, right? You may have it in your head office, which is centrally located. Then how do you support the employees, right? Because imagine your front office staff, the laptop or the system stops working. That is, you need support immediately, right? You can't wait, because then the queue of the patients will just increase. So in those scenarios, or those are the use cases which we have seen in the hospital industry as well, or the healthcare industry. So a couple of things what we have seen, right, which is normally, I would say, a trend post COVID is, the companies are looking at tools which can provide quick diagnostics, right, irrespective of the system. Because today, like we've seen in so many hospitals, we don't have people sitting behind the desk and helping the patients, right? We have a lot of these patient relationship managers who are having, maybe on the mobile or maybe on iPads, etc., where we are accessing information. So it is important that the support tool that you choose can have is not only built for supporting your traditional devices like your laptop and desktop. It should obviously be mobile phones, tablets, etc. And the second thing is it should be easy, because your IT technicians or your help desk technicians need to sort of not really, if it is complicated, because remember, the traditional IT technicians were never supporting mobile or any kind of handheld devices, right? So it needs to be easy. The second thing is, in terms of your service, the support workflow. Um, how do you sort of ensure that the IT technicians are able to handle multiple sessions simultaneously, right? That is another ability that what we are seeing or asked from the healthcare industry. The other part is very, very critical, right? Integration. Is your support tool able to integrate with your day-to-day workflows, right? Because we don't want any tools today to work in silos, right? We need a complete ecosystem to be there. So is the IT support tool that you have, or you want to sort of invest in it, have that robust integrations? It could be with your ticketing tool, it could be with your CRMs, or your the patient relationship management tools, those kind of stuff. In short, if I would say, that's these are the things.
True that. So, Mr. Goyal, I just wanted to check. So, while we are reaching the end, towards the end of our session, any last thoughts or best practices that you would like to share for our viewers?
See, best practices, I would say that one should make sure that their gateway level security is properly done up, properly updated. Their all the operating system and applications are properly patched and updated. Their endpoint security is properly done up. Their data is whatever is the critical data is properly backed up on the differential daily, weekly, monthly, and yearly basis, and data at rest is encrypted, and data in transition also encrypted if you have a multiple hospital, multiple facilities where data is traveling, critical data is traveling. So people do take care of gateway level security and endpoint level of security and on-prem security, but people are not much aware and taking care of the data in transit, which is most vulnerable part of it and easily hackable. So one should be very much aware about data in transition and security of it.
Yes, actually, that's very important because, while we are securing the pieces which are there, maybe in our own premises or maybe wherever the data is hosted, when the data is moved from one place to the other, when it moves, that movement needs to be controlled and secure as well. So, on that note, Triveni, from you as well, any best practices that you would like to share for our viewers?
Yeah, I think on the same lines, data security is of prime importance, because data is everything today, specifically in the healthcare industry. Also, besides that, I think one of the main things, and taking a cue from what happened at AIMS, right? Access to that data. I think who has access to what level of data, defining those rules, and ensuring, creating those different set of groups depending on the confidentiality of the data, that becomes very critical, right? So I think that's definitely one. And like I mentioned earlier, the second point I would like to reiterate is, I think when we talk about security, don't only look at a device level security, but please look at the human level as well.
Couldn't agree more, Triveni. So, with that, I'd like to conclude my session. Thank you so much, Mr. Arun Goyal. It was really nice talking to you, and I think your inputs really made sense for the industry and also, for everything around that functions around IT. And thank you so much, Triveni. Your inputs from the organization perspective, I think, really add value too. Thank you so much.
Thank you.
Thanks, Afreen.
Thank,
Thanks, Mr. Goyal. Was great sharing the
thank
time.
you, Triveni. Thanks. Thank you so much.